Hello everyone, my name is Arash Raghebi. Today I will be discussing the link between Dercum's disease and COVID-19. Also, I'm going to talk about the current treatments for Dercum's disease, as well as the potential treatments that we can offer. We have nothing to disclose. So let's talk about the potential connections between Dercum's disease and COVID-19. First, let's talk about Dercum's disease and autoimmune disorders. Studies have shown a strong connection between Dercum's disease and autoimmune disorders. One of the notable studies that was done was in 2012 by Hansen that showed that 38% of their patients who had Dercum's disease also had autoimmune disorders. We are not exactly sure what this means, but because there's a well-established connection between COVID-19 and autoimmune disorders, this could be one of the links between the two diseases. Also, we have seen a large number of patients who have had previous infectious diseases that made their Dercums get worse. We think that the reason for this is the inflammatory response from the infectious agents which can cause the Dercums to get worse. Now let's talk about the study that we did and the case review that we have. So we studied 50 patients. 50 patients were observed. What we were mainly looking at was the addition of the nodules, the Dercum's nodules after contracting COVID-19. What we saw was that either the patients did not have any nodules before contracting COVID, and they started developing those after contracting COVID, or they had the symptoms, and the symptoms just got worse after contracting COVID. The study is still at the early stages, and the results were confirmed by ultrasound that was done by Dr. Emily Eicher. Now let's look at the case review that we have. It was a 31-year-old female patient who had no history of Dercum's disease and a history of lipedema. She did not have any nodularities on her lower extremities, and after contracting COVID, she started developing significant amount of nodularities on her lower extremities. Let's look at the timeline for this patient. In 2014, she did liposuction for her lipedema. In October 2020, she did an ultrasound that showed no significant nodularities, Dercum nodularities, on her lower extremities. In December 2020, she contracted COVID that lasted for 2 weeks. She had all the symptoms of COVID, including headache, fatigue, chills, fever, and loss of taste and smell. And in February 2021, she did another ultrasound that showed extreme amount of nodularities in her lower extremities. Here we can see the ultrasound side by side. We see that in October 2020, she did not have, on the left-hand side, we see that there's no nodularities, the superficial fascia is not inflamed, and on the right-hand side, we see that there's significant amount of nodularities that appeared after contracting COVID, and the superficial fascia is actually inflamed. So now, what can be done about Dercum's disease, and what are the treatments? Dercum's disease is actually a very terrible and painful disease that needs to be treated effectively because there are some patients that experience so much pain that they need to use narcotic pain medications in order to deal with this disease. It needs to be treated as soon as possible and very effectively. This disease is also different from lipedema in a way that the nodules appear in different parts of your body, and also from what I've experienced, and I talk to the patients a lot, they say that they feel like the nodules are connected like a chain. So they tell me when they poke somewhere that they think the nodule, one of the nodules exists, they feel the pain all over the body, or the chain that they call it. So now the literature shows that the current treatments for Dercum's disease that exist right now are liposuction and skin excision, which show to be not that useful in treating this patient, this disease, and it doesn't reduce the pain as much. There are some case studies that were done that they excise the lipomas or the nodules, they take out the nodules, and they're gonna be a lot more effective. What we do suggest is that the nodules themselves, taking out the nodules themselves, is not gonna be the most effective treatment that we have. What we suggest is that we should take out the inflamed fascia as well as the Dercum's nodules that is surrounding the nodules actually, which is gonna be a lot more effective in reducing the pain for the patients entirely. Leaving out those inflamed fascias could cause a lot of pain for the patients. As Dr. Jamie Short says, we need to remove everything between the skin and the muscle that is inflamed. Now, the next 3 slides are gonna be graphic videos. I'm gonna be showing you how we take out the lipomas and also how we remove the inflamed fascia. So if you think it's gonna make you uncomfortable, please look away. I will let you know once the videos are over. So the first video is going to be, Dr. Jamie Shores is conducting this video. I'm not sure if it's gonna be playing. Was it playing? Can we play the video? The first one is gonna be, Dr. Jamie Shores is performing this procedure. It has to be very precise and delicate because you need to preserve the rest of the structure of the body, and those should not be hurt. Did it play?
We're gonna have to skip that one. The next one.
Skip that one, okay. The next one, we're gonna see Dr. Jamie Shorts and Dr. West performing the removal of the inflamed fascia. As you can see, the fascia is very inflamed. And they're removing the fascia. This needs to be also done very precisely and delicately because the other structures of the body that are healthy should not be damaged. If these fascia are left in the patient's body, these are gonna be painful. Now, in the next video, Dr. Shores is actually gonna narrate on this. He's gonna explain why Dercum's is so painful and why it is necessary that we should take out the fascia.
All right, so we always talk about lipedema and Dercum's, and I tell everybody it's an inflammatory process, nerves getting trapped and everything. This is a perfect example. This is a superficial nerve. This is gonna be maybe lateral cutaneous. It's gonna give sensation out here. I was able to preserve this even treating Dercum's, but look what happens here. The nerve comes into basically what I call scar ball here. That's why I tell people it's not that simple that we're just taking something or cutting or leaving it. It's really, really hard. I mean, this goes into this stuff here. Where does it go from there? I mean, you can see what a nerve normally looks like, and you can see where it goes into. So this is why people have so much pain with this, so much chronic pain, and it's really, really hard to treat.
Yes, so that's the end of the videos. Now I want to share with you one of the stories of one of the patients that I was closely working with. And I remember calling her one time, and it was 2 months after her surgery. She did the surgery for her Dercum's, and we were talking on the phone, and she was breathing very heavily. I asked her what was the reason for that. And she told me that before the surgery, she was not able to walk around. She had to use a walker in order to walk around. And she told me that the reason that she was breathing very heavily was that because she just got home from a 2-hour hike, which I don't know if I can do a 2-hour hike, but she was doing a 2-hour hike. And she went from a walker to go on hiking after the 2 months after the surgery, which was the one that really stood up for me. Now, what are the future directions? It's really important to be able to understand the link between Dercum's disease and COVID-19 because of the widespread COVID-19. And also, the future directions that we have, the study, as I said, is still in early stages. We need to understand the link between COVID-19 and Dercum's to be able to diagnose the Dercum's disease a lot more effectively. Also, one of the things that we want to look at, I've spoken to a lot of patients that told me about when they got the vaccine, they experienced Dercum's disease. Well, that's one of the directions that we should really focus on, the vaccine and also COVID-19 at the same time. This is going to help the patients a lot. When they go to their physicians, they're going to mention the contraction of COVID-19 along with the symptoms so the physician can give them proper diagnosis. Thank you. This is our information. If you have any questions or if you have any stories that you want to share with us or you want to be part of their stories, similar stories, we would love to hear it. We would love to hear from you. Thank you so much.
We do have time for a couple questions, if you'd like
Sure.
to take us up.
Yeah.
Absolutely.
Absolutely.
So one question is why haven't we heard more about surgical interventions in the East? Or what is your opinion on why we haven't heard about surgical interventions in the East to treat Dercum's? And because we've seen some studies and treatments in India with promising results.
I have seen a lot of literature from the East also. They have some really interesting and promising interventions, mostly in South Korea. I've seen a lot of studies that was done. We are actually looking at those to see if those could be a lot more effective in treating Dercum's disease. So far, from what we've seen, excision of the lipomas along with the inflamed fascia was the most effective in reducing the pain for the patients.
Okay, thank you.
Thank you.